with our daily broadcast. I've been busy watching the rugby, watching England thankfully beat France, and that's why I'm wearing my England rugby top now. And it's quite relevant that today's topics that I'm going to talk to you with regard to foot problems is musculoskeletal problems, because these are sort of things like sporting injuries that you might pick up by playing rugby or football, running, but also it can apply to normal day-to-day activities, taking the dog for a walk, going for a hike. All sorts of things can cause musculoskeletal problems. So the sort of thing from sporting perspective you'd be seeing would be people coming with sprains or strains, either acute issues or chronic long-standing issues, patients who maybe weren't rehabbed properly after having injury many years ago. And then, of course, you've got the obvious things like fractures. It's very easy to break some of the small bones in the foot, or you can have stress fractures, which are is a form of fracture that develops over a period of time from repetitive strain on an area. And other musculoskeletal issues that we come across are neuromas, which are cysts on the nerve, particularly nerve that run between the long bones of the feet, down by the ball of the foot. They can be quite troublesome for patients, causing pain and difficulty in certain types of footwear for them. You can get, we deal with Achilles Tendonitis, so that's the ligament at the back of the heel getting inflamed and irritated. Posterior Tibialis tendon dysfunction, which is the tendon along the inside of the ankle that gets either irritated or can actually tear quite easily. There's different grades of damage that can be done to that tendon. You've also got peroneal tendon damage, which is the tendons on the outside of the ankle. You've got the extensor tendons on the top of the foot that can develop tendonitis. All of these can be really painful because every step that you take, you're using all of these tendons with the muscles attached to them, and it can cause quite a lot of discomfort and limitation of mobility. Fortunately, we have a lot of magic tools in our toolbox at Health First that can help with these conditions, along with more troublesome conditions like plantar fasciitis and heel pain. There's a ligament that runs across the sole of the foot from the heel bone to the ball of the foot, and that can get irritated, particularly where it inserts into the heel. And it's so much of a problem that there are several Facebook forums dedicated to this as a condition. And we hear lots of stories of patients who are struggling to cope with it. But predominantly it's because they haven't got the diagnosis right, and therefore the advice they're getting isn't necessarily the best for the management of their condition. Plantar fasciitis being one of only, or one of the 40 odd potential diagnoses for heel pain. So it's important with any of these musculoskeletal conditions to get that accurate diagnosis following in-depth assessment, so you can get on an individualised treatment plan to get you sorted. Preferably seeing somebody like ourselves who have lots of tools in our toolbox. We have shockwave therapy available, we have steroid injection therapy available, we have high intensity laser therapy available, all of which can really help to get tissues healing, alongside the approach of actually rehabilitating the tissues so you get better permanently, not temporarily, so that you don't end up having to come back for any treatments again. And sometimes you have to use insoles, orthotic strapping, support socks, footwear modifications, all sorts of options for treating different musculoskeletal problems. One of the most common of the musculoskeletal problems that will generally affect most people in their life would be some form of osteoarthritic change in their feet over years, where there's some degeneration, some impairment in the way one of the joints function. And there's 33 joints in the feet, so there's a lot that can go wrong. And I've mentioned it before about the advantage of laser therapy, which is a real game changer for patients who have got osteoarthritic issues. We really do transform their lives. I had a lady who could hardly walk on the early days when I had laser therapy. She was unable to ride her horses. She could hardly walk. Both feet severely affected. I didn't think we could actually achieve anything for it. It was that bad. I thought we should need fusion of her ankles to get rid of the pain. When in fact, a course of laser therapy, and she was back riding a horse and walking around without any pain, which was fantastic. So if you've got any musculoskeletal problems going on with your feet, give us a call, 01926 811 272. Check out our website, healthfirstsound.co.uk, and our virtual podiatry feature, which has got lots of useful information for you to find your foot pain and get advice on it. And also check out our YouTube channel, Health First Foot and Gait Clinic, which has got lots of videos on there to help you as well. I'll leave you to your evening now. Thanks, guys. Bye for now.